you very much. This is Dr. Chernoff, and I'm going to address the first half of this on adult learning principles and practice. And the objectives for today's presentations are to define a model of adult learning called andragogy, describe adult learner characteristics, delineate effective teaching methods for adult learners, and develop reinforcement strategies. Teaching and learning is often an inadequate and ineffective way to go when the focus is really on teaching rather than on the interpersonal and learning components of the process. Dr. Malcolm Knowles coined the phrase andragogy as opposed to pedagogy, pedagogy being a description of education, formal education, in a structured setting such as a school. It really has more to do with students in elementary, junior, and senior high school, and even in some college settings, whereas this model of adult learning, as described by Knowles, really focuses more on the relationship between teacher and students, where there is a lot of mutual respect, the student for the teacher and the teacher for the student. The student's experience counts for as much as the teacher's knowledge, and the learning is student-centered rather than teaching-centered. I think that as we talk about adult learning characteristics, Knowles' model of adult learning becomes very practical and focused on the adult and on the learner. Pedagogy, on the other hand, really focuses on the transfer of information. Knowles recognizes the fact that the adult learner has a different set of expectations and a different approach to learning. Can I ask that whoever is moving paper around put your phone on mute, because there's a lot of static on the line when you move paper. Thank you very much. The adult learner really has a problem-centered orientation to learning. When an adult engages in any kind of an experience to obtain new information or new knowledge, it generally has to do with something relevant to their experience, their development, their future goals. The adult learner has an accumulation of life experiences upon which new learning experiences can be built. Taking advantage of that experience and integrating new knowledge is an example of how it is that adults learn. It makes the new information relevant to them. They can put it into a context that is meaningful and that they will be able to use in the future. Adults have an intrinsic motivation to learn as long as they foresee or they perceive that they are gaining something from learning that information or integrating that knowledge into what it is that they are doing or they are planning on doing. Adults have a need to be self-directed and do better when they can make decisions about which learning activities they choose to participate in. So Knowles' approach to adult learning actually promotes a climate of openness and information sharing. It's more of a two-way information exchange as opposed to pedagogy, which tends to be one way. It tends to be from the teacher to the student. In adult learning, the flow of information actually should be back and forth. It should be shared between the teacher and the student. This is a part of the climate of collaboration of student and teacher working together, regardless of who the student is, but developing a one-on-one type of a relationship with the teacher, the student becomes part of the learning process more than just a receptacle for information. In Knoll's model of adult learning, competence, and which comes from mutual respect, is essential to an effective kind of education process. This allows for more creativity, straying out of the box, and using and learning things that one might have otherwise not expected, and it leads to an atmosphere of success. All of these learning experiences really should be set up to ensure success on the part of both the learner and the teacher. Adult learners tend to be very heterogeneous. They have had life experiences, they have a base of knowledge, they command respect due to them as mature individuals who have made their way in the world to a certain point. They need to be involved in any kind of decision making of whether or not they will engage in certain activities that meet their needs, or searching with the teacher in terms of finding things that better suit their needs. We, in geriatrics, we try very, very hard to create an atmosphere where we identify each learner's specific needs and try and create an environment and opportunities and experiences for them that support their need for information, their need for new skills learning, their need to be able to express themselves and find things that fulfill the needs that they are having. We certainly encourage the expression of differences of opinion. Once again, I referred earlier to the fact that adult learners are not just receptacles for information, but need to be part of the process, need to be able to share their thoughts, their ideas, and their opinions in a safe environment. It is very important to be able to have open discussions and look at various opinions about a subject so that the learner is involved and integrated into the learning process. We try really hard to think outside the box to minimize the use of rules and regulations. Sometimes in the VA that's challenging. And there has to be a recognition of the fact that people have different reasons for participating in educational opportunities. In pedagogy, most of the learners are there because they have to be. In andragogy, the learners are there because they want to be. And we need to identify what their needs and wants are in order to make it a successful interaction. The adult learner has unique characteristics. They do not want to waste time on irrelevant and repetitious material. They are more likely to go to the teacher, whoever that may be, to ask questions than are young learners. One of the things that we encounter a great deal in dealing with adults is that they need to have maximum flexibility in scheduling learning activities. They do have other responsibilities. They often have families. They often have jobs. And they need to be able to arrange learning activities to fit into their life as it is. Because of their schedule and because of their lifestyle, they really want to stop and start learning activities on time. They have allocated a certain number of minutes or hours to an event, and will start getting very anxious or simply get up and leave if whatever it is that they need to go do, if the learning activity infringes on whatever it is that they have to get up and go do. We see it all the time in our continuing education symposia, that if we say we're going to end at 4 and we run over, people get up and walk out at 4. And we try very hard to stay on time in order to share the maximum amount of information from our speakers. Adult learners have numerous life and work backgrounds. They are all very different from each other. Each of them comes to any kind of learning activity with the baggage of past experiences, and oftentimes that's very good. Oftentimes that is what it is that has led them to your learning opportunity. It is a very wise move on the part of a teacher or lecturer to be very open about acknowledging the fact that students do come with knowledge and skills, and that the purpose of an educational event is to enhance them, to increase them, to add new information into their knowledge. Adult learners may be less flexible because they are encountering a lot of new ideas and approaches and really need to see the relevance of what it is that you are trying to teach them. It is very important not to challenge people and to accept whatever contributions they make in terms of a discussion group or asking questions of a speaker, and Dr. Howe will address some of this in a few moments. It's important for a teacher of adults to try and develop an open-mindedness, because people are coming to the event who have different experiences, who have a different knowledge base, and who are looking to fill in empty gaps in what it is that they know. Adult learners may have had negative past learning experiences, and we need to make an effort to avoid situations where failure or feelings of inadequacy may arise. I alluded earlier to the fact that we try and set up learning experiences as a win-win situation, as a positive experience for the adult learner. And one of the ways that we do this is we try to interview people who will be part of a small group prior to that small group meeting, so we get a sense of where it is that people are in terms of their need to learn, what their past experiences are, and what it is that they're interested in getting out of the event that they are about to participate in. We have to assume, and should assume, that every learner has the ability to grasp and integrate the information that we are going to present to them. They are voluntary learners, and they have very personal and very specific motivations about what it is that they are coming to an event for. I often talk about the radio station that runs in everybody's head. It's called WIIFM. It stands for What's in It for Me. And the overriding goal that any adult comes to a learning activity for is the what's in it for me. What is it that I'm going to get out of this? What is it that I'm about to pay tuition for or pay a registration fee for? And what is it that I'm going to get out of this? We need to sort of take the other person's point of view sometimes when we are developing educational materials and educational opportunities in terms of what is it that the learner will in fact be able to get. And that's one of the reasons that we write learning objectives in terms of behavior changes from the point of view of the learner. Adult learners tend to be problem-centered learners. They focus on that which they are going to be able to take with them, that which they are able to integrate into the framework of the knowledge that they come to the learning experience with. They are looking for either new information to help them do their job better, new skills to provide better patient care, and basically are looking for the take-home message. When we do interviews and talk to people before a learning event, the first thing they will tell you is their highest priority generally. And it's very important to try and meet their highest priority. If they're there to learn a skill, that's what they want to learn. You can integrate information into the process of teaching them the skill, but they tend to be fairly focused and have an agenda, be it something that they are willing to be upfront about or something that they keep internalized, but they are looking for information that they can use or that will help them understand something very immediately. We write behavioral objectives for educational events, whether they are CME or CEU programs, whether they are webinars, whether they are video teleconferences, whether or not they're skills development workshops, in order to set the framework of what it is that we hope people will come away with and why it is that we, in fact, are doing this particular event. So the distinguishing characteristics of adult learners, in summary, are that they are knowledgeable learners. They are not blank slates. They have experience and knowledge that they bring with them. And we need to have the respect to interact with them as colleagues and not as a superior to an inferior or a teacher to a child. They are self-directed learners, and so we need to find a way of identifying what their specific needs are and trying to meet those needs. They also will have varying needs in terms of what it is that they want to know or disabilities that they may have. This is something that we tend to think about where we are dealing with child learners, but with adult learners, we sometimes take it for granted that somebody coming to an educational event will be able to see and hear and, in fact, get to the learning space. So what we need to do is to encourage understanding and application of new information. We need to enable adult learners to be self-directed. We need to collaborate with our learners, and we need to create an environment where we can encourage critical thinking and the introduction of new ideas. And with that, I'm now going to turn this over to Dr. Howe, who's going to talk about teaching methods and how we actually implement the principles that I've just set forth.
Thank you, Dr. Chernoff, for an excellent introduction. I am going to, as Dr. Chernoff said, talk about some commonly used teaching learning methods for adult learners. Now, both Dr. Chernoff and I, Dr. Kramer, and our colleagues who are GREC Associate Directors for Education and Evaluation are responsible for a number of interprofessional or interdisciplinary teaching programs. For instance, I have an interdisciplinary palliative care fellowship program here, and many, if not most of us, also train associated health professional students in a range of disciplines, from nursing to social work to audiology. Of course, we also sponsor fellowships for physicians and medical residents. So drawing on all of this experience, many of us have developed what we believe to be the most successful teaching learning methods for engaging adult learners, which the bulk of our learners are. As Dr. Chernoff said, we also run a number of continuing education programs, whether in our hats as GREC Associate Directors Education or in our hat as the Geriatric Education Center. And in those continuing education programs, the vast majority of the learners, at least in my case, are significantly older. The first method that I would like to talk about is the seminar method. We've all been exposed to seminars, throughout our learning, and this is, of course, opposed to a large classroom setting which has a lecture format. In a seminar, the learners are able to engage in a discussion which they help to take responsibility for in terms of structure and content during the teaching learning experience. The facilitator, the instructor, the preceptor is really not an instructor but a facilitator of information exchange and encourages critical thinking and problem solving in the seminar format. So it is a useful format for the dissemination and critical evaluation of theoretical and empirical literature. And in fact, most of the seminars that I have run or facilitated in my career have included literature readings which the learners read in advance, hopefully read in advance of the actual seminar. It doesn't always happen. I'm going backwards on this, my apologies. Seminars are consistent with that very difficult to pronounce word called andragogy, which Dr. Malcolm Knowles popularized, in which Dr. Chernoff has described to you in the Principles of Adult Learning Theory. In this approach, we stress the use of experiences and self-motivation in adult learning, and we find that the seminar format is ideal for this. As I mentioned, we can bridge the theory and practice gap through seminars. And hold on, my computer just went off. And it's also in the interdisciplinary, interprofessional teaching learning that we facilitate. We have learners from so many different disciplines and professions in the room at the same time that we find that the seminar format really increases awareness of professional roles, scopes of practice, and responsibilities of the different professions represented. And I'm going to talk a little bit more about this in a minute. And finally, the seminar format allows the challenge of established practices in light of literature and the experience of peers. Now, I wanted just to go over some strengths of this format and some considerations, potential issues of the seminar format as well. As I've said before, it does assist in critical thinking, independence, and problem solving. And it draws on the learner's experiences, particularly, as Dr. Chernoff said, when we do have learners that are out in the workforce already, who are going back to school to get an advanced nursing degree, to get their MSW or whatever, there is a wealth of experience and perspectives that can be brought to the discussion, much more than you see in more junior learners, even in, let's say, for instance, first-year medical students, many who have gone straight from undergraduate school. It also is key in developing skills in group leadership, communication, and understanding group dynamics. I'll talk about that a little bit more. We talk about problem-based learning, but it is very conducive to the enhancement of group leadership capabilities. In fact, and finally, in a small, more intimate classroom, seminar format, where hopefully you're sitting around a oblong or round table, the trainees can really see the facilitator and how the facilitator approaches problem solving, how the facilitator leads discussions. And so the faculty member can role model behavior in this more intimate setting in an easier way. Now, some considerations considerations for those of you who may be thinking about setting up a seminar series or a journal club. The group size is really critical. When I first developed this slide, I had 5 to 18, I think, and then I kind of whittled it down over the years. I really think much more than 12 learners in a seminar is a stretch for the intimacy and the conversation and the kind of, safe environment of learning that a seminar strives for. You do need to set ground rules in terms of confidentiality, particularly if you're discussing clients or patients, or even just in terms of, sharing some personal experience in the seminar. It's, I think, key to underscore with the learners at the outset the need to value others' opinions, not to cut in, and that we're there for critical analysis of the issues, and that we're not there to attack personalities or different political viewpoints. Not too long ago in a first-year medical student art and sciences medicine small group that I facilitate, there was some fairly heated discussion, which is getting out there a bit, about health reform. So, of course, as a facilitator, we need to, keep those boundaries and get us back to a positive learning experience. And this is something that I have found that's been an issue in the last couple of years, particularly in seminars, and that has to do with BlackBerry or wireless use and also laptop use. I had set ground rules a couple of years ago about not being on BlackBerry during seminar. This year, the faculty have debated the value of having students with laptops in the seminar, taking notes ostensibly, reading, the articles. It does, many faculty have stated, put a bit of a barrier up between the learner and the facilitator with the laptop at the table. And then finally, students must be prepared to participate. The facilitator needs to lay out the ground rules from the get-go, that readings must be completed, the handouts must be read, and any assignments must be fulfilled in advance. Which way do I go? Okay. I wanted to go now over some interactive teaching learning methods that my colleagues and I have found to be particularly useful. They provide really a list to choose from depending on the topic, depending on your interest, depending on the level of the learners, and the interdisciplinary mix. The first is the workshop. Many of us have participated in interactive workshops. I think those that are most successful are workshops which have opportunity for interactions, whether they be embedded skill laboratories, panel discussions, videotapes, role plays, and so on. And I'm going to talk about some of those techniques now. The second general approach is problem-based learning. Now, since I know that many of you are physicians and other health providers, you most likely had problem-based learning in your medical or healthcare training and education. So as you're probably aware, in problem-based learning, the trainees learn to work with classmates to solve complex and authentic problems that not only help develop content knowledge, but also problem-solving skills, reasoning, self-assessment, and communication with peers. The teachers are, of course, facilitators rather than disseminators of information in the problem-based learning approach. And oftentimes, the facilitator will provide what's sometimes called ill-structured cases or open-ended problems that have multiple solutions, and the trainees then work together as a group in solving these problems, or coming up with solutions in what can also be called unfolding cases, where the facilitator gives out pieces of the case in stages in a longitudinal manner. So it really is an approach that fosters interprofessional teamwork and strengthens communication skills. Also, sometimes facilitators find that a little mini lecture or mini seminar at the beginning of the session helps to get the conversation and the group problem-solving process going with the facilitators and with the learners. Tabletop exercises are, what it sounds like. You can, let's say, if you're putting together a disaster drill scenario, emergency preparedness problem for older persons or something like that, you would actually put a map, for instance, on the table, and it would be the trigger for the group problem solving. Another interactive teaching learning method, which you've all participated in some way, are internships. And these can be not only clinical, but also administrative or policy. Fellowships and scholars programs, such as what you are participating in now in the Rural Geriatric Scholar Learning Community, are part of this general category. Group work through group assignments with a problem-based learning approach, and the evaluation of group process is something we've used as well. When I have facilitated sessions on developing interprofessional teamwork, I have often used exercises where group process is evaluated. Another approach is reading and discussing case studies, and also developing cases as a group. Grand rounds are a traditional interactive teaching learning method, as are clinical case conferences and discussions. A tool that I've used in the past with master's level trainees are reflective processes. These can be diaries, logs, or journals. They're called different names. You have to set a ground rule up front as to whether the facilitator or teacher will look at the journals. Sometimes the teacher will look at them and make notes and return it back to the trainee. Oftentimes they're kept private, but it is a way to grow as a healthcare professional through self-reflection. Role modeling can be used in a small group context. You could play out a scenario in terms of communication, in terms of interviewing patients. At Mount Sinai, we use standardized patients with our first-year medical students, and then we role-play provider-patient interactions. There are some games out there in geriatrics. I want to give credit to our colleague, Dr. Nina Tumosa. She and Dr. John Morley have come up with a number of crossword puzzles on geriatrics, on topics ranging from dementia to incontinence to pressure ulcers, and they also have another, something like Jeopardy, but it's called Gerapeti or something like that. But they are a source for many games, and we could certainly give you that information later. One can learn a lot from one's mentors and one's mentees as well, and I think that this one-on-one precepting and mentoring, which you have the opportunity for in this Geri Scholars program, is an important technique. Skill labs, I mentioned before when I was talking about workshops. And skill labs that we use here in our CME courses, we have one that's a 5-minute geriatric assessment. We have another that's a hearing assessment. We have another that demonstrates how to administer advanced care plan. and you can set them up so that the learners move from station to station. Journal and book clubs are a traditional approach. I think that book clubs in particular are very helpful for discussion that's oftentimes more broader than a journal club. Now, you as a geriatric scholars are participating in an online learning community now, and I saw that Dr. Jones has put up all kinds of resources on your Geri Scholars Learning Community. I just went on and looked at that about an hour ago, and I really urge you to partake in that learning community. Other variations are chats and Blackboard and forums, and so you are really at the cutting edge. I see I just have a few more minutes, so I think I have time here. Brainstorming is another interactive teaching learning method. It's really most often used in problem-based learning sessions where the learners can, start off the group process by brainstorming possible options or solutions. I like debates where you have one learner take on one side of an issue and the other take on the other side. And I think it helps develop communication skills, self-confidence, and it does enhance critical thinking skills. Interviewing. This is actually an idea that I got from Martha Wade, who is a colleague of Dr. Kramer's at UCLA. I have adapted an instrument that she put together some years ago, whereas associated health trainees in the GREC program interview each other as to why they went into their particular healthcare discipline. They interview each other about the course of their training, what their internships cover, and so on. And it's amazing because it's very, usually we find that the students know very little about the other disciplines, the other healthcare disciplines. I mean, people often have a general idea about medical training, but when it comes to nursing training, the different certificates and specialties for nursing, for instance, for social work and other allied health professions, there is not a lot of knowledge about this. So this really does help when the trainees go into the practice world to have an understanding of the scope of practice and the considerable training and education of their colleagues from other disciplines. Other approaches include debriefings. After a difficult case, for instance, a team could debrief. Panel discussions are a useful tool, particularly to be embedded in a CME course or workshop. We use interactive videos, really trigger tapes where you show a piece of a film or an educational videotape which engenders a group discussion. And then finally, the watch one, do one, teach one approach for skills development, which is used in so many healthcare professional training programs at this time. Well, I see that I quarter of, and I have some other examples here, which include videotaping group process with feedback. I've mentioned standardized patients. Self-study, if you have motivated learners, which adult learners usually are, can be very effective. Reading and then answering questions, journal articles, using learning packets, which nursing schools do a lot. Demonstration, return demonstration, which is very similar to the watch one, do one, teach one. Independent study, which could be a contract that you would have with a supervisor or more senior individual in terms of maybe doing a meta-analysis or review of the literature. We do that with our fellows in our palliative care fellowship program here. And field trips. It sounds like that's something you would do do in 6th grade, but when you're in a fellowship program, palliative care, for instance, it might make a lot of sense to go to a funeral home and understand the process and the customs of dealing with the body and the family in the funeral home. Now, the final 3 points we have are just reinforcement for learning. And, we've given you a plethora of techniques here, but it is helpful that the learning opportunity be enriched, strengthened, and made more enduring through handouts. You could do follow-up pearls in a learning community such as the one you're engaged in. That could be through emails, through, additions, to the online learning community. It's just a way of just keeping the learner engaged in the problem and in the issue. Finally, reflective evaluations is really something that I think we as facilitators and teachers need to do, and that would be at the end of, a webinar such as this, for Dr. Chernoff and myself to sit back and say, well, what could we have addressed? What could we have emphasized more? What could we do better the next time? So that concludes my section.